Hey guys, welcome back for another installment of Neuro Life Skills. We're honored today to have Dr. Rob Scott, the president of the university here at Life University, here with us today to kind of nerd out on, we'll see where it goes. Maybe some neurophysiology, maybe kind of where functional neurology is or what the purpose of all of this stuff is.
And maybe not a lot of nerding.
Not a lot of nerding. You're nerdier than you let on, I
know,
think sometimes.
I can be pretty left-brained sometimes.
That's why I'm excited about this conversation. I think it'll be fun. As always, we're going to try to leave you with just some tidbits, neuro life skills, things to help with brain health and brain physiology more than anything, kind of as we go away with this. So hopefully we pull some good nuggets out of this one for brain health and for just brain expression and overall health and well-being from a mental health perspective as well as a physical health perspective. So we'll kind of jump right in with it. I know you've got some questions for us, but I've got some questions for you. One thing that fascinates me in you do a great job with running the school and the academic side of things, but I always kind of, when I talk to people, I always tout you as the smartest chiropractic school president out there because of your history. And you did, some research on electrophysiology and kind of, going a little nerdy down that route. So, I've read some of your stuff on oxygen and the importance of that. And one thing where I think chiropractic is different, and maybe holistic medicine, if you want to put that into all one category, is different than maybe conventional medicine or allopathic medicine, is that we're always looking at the body as a system of physiology, how things work, how they function, and not necessarily as something grossly broken. One of my favorite quotes, and I'm going to paraphrase it because I never get it right, but chiropractic is more about living and health, and maybe the allopathic side is more about disease. And we focus more on the function and driving the physiology behind things. And I think that ties into a lot of your, what you've done in the past. So if you wouldn't mind sharing just a little bit of your background, I guess, in that, and just a general kind of overview.
My journey. So, I'll just clarify. I mean, there's one thing that's changed in our profession, of course, is that a lot of chiropractic presidents now have doctoral degrees in education, as opposed to just their DC degree, right? So it's big change. Lots of PhD, EDDs. I'm probably the only chiropractic president right now that has a PhD in an applied physiology in a science field. So it does give me a little different perspective than just educational policy and administration. But I lived in that world before becoming a chiropractor. Undergrad and grad school were in physiology for me, and I enjoyed it immensely. It was my experience there that kind of drove me to want to go and do a PhD, but then life gets in the way and those sorts of things. I got into chiropractic, and when the opportunity presented itself, I followed up on the studies in chiropractic, which were fascinating because if I'd done it earlier, I would have been in a totally different field. But since I had the chiropractic background, I said, okay, let's go in and look at some of these things called chiropractic adjustments on physiological effects of what's going on in your brain. And of course, I was looking at cerebral vascular hemodynamics, blood flow to the brain. Little different things than what you guys are looking at, but that was my area of kind of interest in my doctoral studies.
Yeah, and that's kind of the jumping off point for all of this, is where a lot of the research has gone with chiropractic, at least in my time here, has been fascinating watching what Dr. Sullivan's put together here on campus, as well as Dr. Havik overseas and Dr. Murphy up in Canada, in that when I got into the profession, it was a little bit about bone on a nerve stuff, and my experience didn't really fit into that bone on a nerve thing. So when I got here and saw, they were hooking people up to EEGs, which for those of you guys that don't know what an EEG is, that's the cap that you put on that has all the little electrodes attached to it, and it measures brain waves, or how the brain responds to information and how it forms responses to the environment, essentially. And doing adjustments and then measuring that, it was fascinating to me, and what I thought was really kind of, what my experience was with chiropractic, in that it was creating overall health and function of the nervous system and brain changes in that way. And you talking about hemodynamics, see, it got nerdy already. You throw a word out like hemodynamics and it's instantly a nerdy conversation. But blood flow and things like that, blood goes to where our brain is functioning. So, you know, that's one thing that when you adjust or when you do different therapies or different things like we do here, we drive blood and resources to the area of the brain that makes us more human or improves our function or improves our physiology and our overall state. So that's why I was looking forward to this conversation with you to touch in on some of those things.
But that's a really good point, because when people think of chiropractic, I know this was certainly my experience, and probably a lot of the patients who come into the clinics are the exact same way. You know, they've hurt themselves. They're coming in because of a pain response, whether it's a sprain, strain, a musculoskeletal type injury is usually what's coming in, low back pain, neck pain, right? And that was my experience. That's the only thing I thought chiropractic did, was try to address my pain. And then as I started to understand what the connection was on the neurological basis of what we do, and when we talk about subluxation, the neurological basis of subluxation, yeah, it does great stuff for pain management and pain control in musculoskeletal type conditions. But when you extrapolate beyond those kind of local, regional type effects of adjustments and start to really extrapolate and almost kind of start to ask, well, if it's a neurological basis, and what does that possibly control? I started going into things like peripheral vascular diseases. You know, if a chiropractic adjustment goes to all these areas of the vasculature and controls smooth muscle and vasodilation and those types of issues, then what does an adjustment do to that? And if you can actually literally affect vasal tone through chiropractic adjustments, and all of the vascular conditions that we have some degree of vasal tone issues tied to them, then you have to start asking questions. Well, my God, can chiropractic care not only help me with my low back pain, but could, and it's a question because it's unanswered, right? We haven't done the science on it, but could chiropractic care potentially affect long-term outcomes of vascular health? Then my mom died of a heart disease, and we had it in the family, so that was a really intriguing question for me. And what we found, or I found in the lab at the University of Minnesota, is that a single chiropractic adjustment affected the shear stress on transcranial blood flow. So the vessel wall and the velocity of the blood affected the shear stress on the endothelium. And you know, the shear stress is what affects the enzymes and things that are in the mechanism of vasodilation and constriction. And you sit there and you go, well, if you can actually affect the shear stresses on the tissues in the vascular wall of these vessels, and that's a precursor or a particular indicator in endothelial dysfunction, you know, or the platelet breakdown, then I'm sitting there going, well, there's a whole area of potential chiropractic effects just from a single little study. We haven't done it. We haven't, you know, there hasn't been more area or investigation in those areas, but apply it to everything you guys are doing, right? You sit down here and you look at the stuff, the conditions, and the people you treat here. I've been in here observing through the years, and I've seen elderly people come in who were in wheelchairs and couldn't speak, and after a period of what you guys do, be able to stand up and say the alphabet. I've seen young people with traumatic brain injuries who are literally in tonic, contracted states go through the protocols down here and become totally flaccid and have smiles on their faces. I mean, these are transformational experiences, right? And you have to ask yourself, what is it about what happens down here? How can you have somebody who has cognitive dysfunctions or traumatic brain injuries and all the things that if you go to the website and you look at the types of conditions you treat down here and provide care for, how's that even possible? Right? What is it that you guys are looking, as you're not a bone on a nerve approach to things, which was the original kind of concept of chiropractic.
Yeah, and I think, you know, for me, it's that looking at function, right? One of my favorite, we did some research and we've done some with Dr. Sullivan here on campus. We compared our examination, which is, you know, the standard exam that's taught to everybody here, maybe with some tweaks and a different focus on how we look at things, and we compared it to those EEG mappings that they did. And they found dysfunction in the same areas that we were naming as dysfunctional or not working quite as efficiently as they should be, right? And then, you know, when you can take and then apply therapies to specifically bring blood flow and activation to the areas that were not functioning well, then you can have a pretty profound effect on a really wide range of things that you can help. You know, Dr. Hall was my mentor down here and started this clinic with us. And we kind of jokingly said when it was, well, how do you market this? Who's your market? And he always said, well, anybody with a brain. And we would joke that there wasn't, maybe not everybody was a candidate that was driving down the highways in Atlanta, but for the most part, anybody who had a brain needed improved function. And some things that we've really fallen into from kind of from neurophysiology standpoint and where research is the mental health piece lately. Whereas, back in the day when I was growing up, mental health issues or depression or anxiety was something bad happened to you and you just needed to shake it off or walk it off or get over it. And what we understand now with advances in the ability to measure brain activity and things like that is it's more associated with a breakdown or a decrease in efficiency in various areas of the brain, or trouble kind of functioning or handling some of those stressors that are put on you in life. Working through examining or picking apart the brain with our functional exam, we can then restore function to that area. And if that area is back online, especially to something like the frontal lobe, that kind of does just about everything, it has a huge, profound effect on a lot of different conditions.
Right. And that's awesome, and I love that you describe it as using the exam as something that we actually use as a platform for treatment, and largely measuring physiology, so things like a pulse oximeter, measuring if we notice an increase in heart rate or a stress response. And often how we describe to patients is making automatic things automatic again. Our brains are really incredible in a way that we actually process so much information. Gravity, sound, light, air, food. We often take it for granted if we lose the ability or it's diminished physiology within those functions. So often what we measure in the exam is which of those areas do we have a window in to make the improvement, and where can we see that improvement? Often it carries itself. When you start perceiving things like light less threatening and more therapeutically, you often are able to have more clear thoughts and able to push blood flow in areas like the frontal lobe. Otherwise it gets wound up in certain areas where you kind of hold back and you almost withdraw. If we picture, you think of somebody, if you have a startle response or a fear response, we go into this fetal position. Well, almost the equivalent of what we're seeing in here is the mental fetal position is a fear response. So we take blood flow and we shunt it as a protective mechanism, and it almost shuts down other functions. So our ability to be a person and interact and perceive our environment often diminished. So it gets to be a lot of fun, and a lot of times one of the first things we see come back with patients is their ability to be themselves again. So whether it's mom or dad or even family members, they start kind of cracking jokes more often and they start letting loose a little bit more. And that gets to be fun, seeing their personality show. And that's how we know we're on the right path, is if we're providing these adjustments, we're doing our therapies, and then also we see them start to come back a little bit more. And that's one of the most fun things in here, is we really see a shift in this fear response, and their shoulders start to let loose a little bit, and they kind of have fun back and forth. And Dr. Longyear jokes a little bit, is that I'm like a king of dad jokes. So I practice, my stand-up routines in here every once in a while, and I don't take it to heart if people don't laugh, but if they do, and if they're able to read the environment, that's actually a measurement tool, and it gets to be a lot of fun back and forth with patients too.
Right.
So it gets to be fun really kind of expanding and seeing how they read the room, as opposed to being in this straight, tight posture, as well as their oxygen improving, and they're able to actually constrict their pupils instead of them being in this frightened animal state. And that's so much of where a lot of people are right now.
But what's interesting when you say that, two things struck me, because you said, when you're doing assessing a patient, you look for a window into identifying the best way in. So when I say windows, I look at things, in the chiropractic philosophy world, and as a physiologist, I've always said that physiology is a window to innate intelligence, the body's ability to adapt. And when we look at chiropractic philosophy and we say, subluxations cause, incoordination in the communication, and an incoordination that's uncorrected for prolonged periods of times results in malfunction. And then malfunction results in what chiropractors call dys-ease, but let's just, for the sake of clarity for people watching, let's just call it disease or symptoms, right? So I sit there and I say, well, what's the best way to measure somebody's adaptive responses? What does dys-ease look like? And it looks like physiological changes. So in the clinic here, maybe differently than what happens in a lot of chiropractic offices, you guys use a lot of really unique ways to assess physiological adaptation
Yeah.
in the body. Talk about some of the things, the ways that you look at, you have windows to the physiology.
Well, literally a window, my favorite one is, you hear the expression, the eyes are the window to the soul. And they're also a direct picture of the health and function of your central nervous system. So we look really closely at eye movements, not necessarily vision. And I think that's something that oftentimes gets confused is, I'm not gonna put an eye chart up and tell you to read E, TOP or whatever the levels are, but it's how well your eyes move together, how quickly they are. I love that you use the word coordinated, because coordination is a big thing. So we look really closely at the eyes and how well they function. Really fast movements, like going from side to side as fast as you can, tell us about the health and function of the front part of the brain. Side to side movements tell us about more of the back of the brain, or slow sweeping movements, more about the back of the brain. If it's up and down, that's another area of the brain, and if it's side to side, it's a completely different area. So we get a large window into the nervous system and physiology by how efficient they are or how coordinated they are with their eye movements. And the other one that Dr. Dom already illuminated or started with was the pulse oximeter. So if we're doing something, a pulse oximeter, for those of you guys out there that don't know, it has oxygen saturation. 100% is the best. You really don't ever want it to get below 98%. And it also measures heart rate. And so if we're higher heart rate, that's more stressed out. If it's a lower heart rate, that's a calmer, more adaptable system, right? So we usually walk around with one of those on everybody's finger, and we're always watching pupils or watching eye responses and things like that. The other one that's really kind of at the forefront of research and healthcare right now is what's known as heart rate variability. And I know, especially in our research department here, they're using a lot of different things like the caretaker unit and things like that to measure HRV, and we have our ways of kind of measuring that here as well. And that ties into what we know as vagal tone, or this idea of, the stronger our rest, digest, and rebuild system is, the better our health is. So we're constantly measuring it with some pretty high-tech looking kind of fun things, but some really low-tech things like a pulse oximeter as well.
Speaking of heart rate variability, so it was fascinating when I spoke earlier about the far-reaching ramifications of potential chiropractic adjustments, and then listening to Dr. Yuri Gidron from Israel talk here about the global burden of disease and the effects or the possibility for something like heart rate variability to be used as an indicator on for health of the global burden of disease, right?
Yeah.
And you sit there and you go, okay, well, this is fine. You look at the gastrointestinal system, respiratory system, cardiovascular systems, and the immune system as all major areas that have direct, reciprocal connections for people's health. And then I start saying, like I always do, and we haven't done the research, man, is it possible that chiropractic care and adjustments can literally affect major burdens of disease globally in this country? Now, those are big questions. They're unanswered. It's pure speculation, but that's what blows my hair back. I mean, that's exciting stuff to start thinking about the impact of that.
Yeah, absolutely.
Now, you said something, if I can you mentioned, the eyes is using a different movement patterns go to different parts of the brain. So if you're dealing with somebody with a traumatic brain injury, for instance, they might have actually damaged or likely have damaged a region of their brain. And of course, when you damage your brain, it's a serious problem. But what you guys can literally do here through the approach to care is utilize the concept of neuroplasticity. So describe, how what that is and how you utilize that in that type of care.
Yeah, so it's this idea of not necessarily saying, okay, activate and regrow these giant gray matter pieces, but it's the interneuronal connections. So, I mean, us from the north?
Canada.
Okay, way north.
Canada.
Okay. So I'm from Michigan, Dr. Long is from Michigan. So a way that I like to describe it is in snow. So I'm sorry, Georgia people, I'm sorry for people below the midline of the United States. But a lot of times, fair. So we have these efficient pathways, and sometimes we basically get a cloudiness or maybe even a snow that covers them up. So once we start using them a little bit and practice it, they get a lot more clear and we can actually see through them a little bit better. Our brain likes efficient pathways. We use that in ways that we just absorb them and we use them automatically. So the more that we take, and kind of like how I said before, automatic processes and make them less automatic, it takes a lot of energy from the brain to divert attention to that. So that depletes near everything. So if we improve systems like thought and these giant networks that an adjustment affects, like the cerebellum and the frontal lobe, it affects near everything. That's basically our ability to coordinate thought, emotion, movement, as well as the feedback loop of, now when I use it going forward, can I continue to build that as we go? And often that's what we focus on in here. Usually we'll start with an adjustment and then we'll do therapies afterwards so that we can build and make that more profound effect and nourish that adjustment so we can activate those brain networks and they can carry it forward.
But when you say therapy, though, you're not talking about the usual therapies we see in our physical therapist, chiropractic offices. You're talking about kind of motor sensory activities as a therapeutic approach that literally require you to utilize a different neurological pathway to create that training process, right?
Absolutely.
So speak to that a little bit too.
Yeah, so with this, a lot of times we can use these really cool pieces of equipment. I mean, we're fortunate enough at Life University to have some really fun toys, one of them being a gyrostim, for example. We can put somebody in a giant off-axis rotational device and strap them in.
Giant spinning chair.
Yeah.
To get rid of our $13 words.
Fair enough. And so with that, we can slowly move people through space, or for some of our high-level athletes and even some of our patients that we've progressed along, we can move them really quick through space and give them something like a head laser to improve control of the neck. Can I have my eyes on a target, and can I find things? We have all kinds of cool targets in there, like shape, color, number, letter. We can get really complicated with what they search for and what they find, but can you see your environment? Can you move your eyes in the direction that we want to? And according to tilt and gravity, can we also have you produce the correct response? And it's all these things that feel and sound really complicated at first, but when we get down to it, often if we put together the right care plan for them and we calculate it just right, it actually feels a lot like a game. And it gets to be a lot of fun back there.
And all those activities of targeting and like identifying a laser or a point when you're moving through these planes of rotation all require kind of firing of your neural networks to be able just to do that. So there's a lot happening in the central nervous system that allows you just to be able to point to things, isn't it? And
Absolutely.
that's kind of the cool part of the repatterning of the neurological piece.
Yeah, and we can be really specific.
Right.
And I think that's where it's a lot of fun, is the specificity behind what we do and kind of how we get there is, you know, again, kind of bringing that idea of blood flow back is, you know, if we do, I had a really interesting patient this past week where she couldn't catch anything in her lower left corner. She could catch everywhere else, but she always was missing in the lower left. Well, and going a little deep in neuro, the left corner of vision processes through your right parietal cortex. And so when we look at what the right parietal cortex does, you know, I said, you know, you can't catch in that lower left. Let's go do some games. And the games were, I had her doing object rotation stuff. So she'd have to see a shape, imagine it flipping 90 degrees to the left, and then recreate it. And we have like a little screen back here, it's a giant touch screen that we can have them do that on. And she could not do it. But what was really cool was after training her to do it, she then had the ability to do the object rotation. We put her back on the Vibe plate and threw stuff at her, and she was 100% catching in that lower left corner. So we can be really specific with what we do, whereas if you take a drug or a medication, it goes into your bloodstream and then you just have it everywhere and you hope it goes to the right spot.
You know, that raises, being a hockey guy, you've raised kind of an interesting analogy for me. So I'm a Toronto Maple Leafs fan, and our goaltenders could probably use some benefit catching the pucks down in the lower corner. But so here's the question. So when you look at what you do, what we traditionally think of as the type of patient you see in here, again, it's, you know, developmental disorders, traumatic brain injury, stroke, you know, severe types of issues. But you also, and you mentioned this too, Dr. Dom, you do elite athletes.
Yeah.
So what's the process? I mean, the same concepts apply to performance at the elite athlete level, or somebody who just wants to perform well.
Yeah, well, and we always say, you know, Dr. Vestal always said, we can take you from good, if we can take you to good from dysfunctional, we can take you then from good to great. And what we started noticing, we treated a lot of athletes with concussion and those kind of injuries. And what they started noticing is when they went back after getting treated for concussion, they actually felt like they were better, quicker, more efficient than they were before the concussion. So we started kind of working through what we call a performance enhancement program. And now we get some guys from Colgate University and some other hockey guys from around the country that come in on the summertime, and we train them up and get their reaction time better, their processing speed better, their ice vision, so to speak, better by working on peripheral vision exercises, all by strengthening areas of the brain to make it more efficient and more functional.
More efficient, yeah.
Yeah.
That's, no, go ahead, sorry.
I was just gonna say, one thing I wanted to touch back on it, because we've brought the word stroke up a couple times, one thing that in your research in the past, as well as chiropractic has kind of been knocked on as almost causing strokes. But when you start to look at like what your research was, the shear strength or the shear stress on the vasculature, and what we know we do as far as improving blood flow and oxygenation to the brain, I actually think we're the best suited to prevent stroke. We always know, I had this conversation with a patient today, we know that chiropractic is great for headaches and back pain, right? And migraines being one of the forms of headache we do really well with. And something that I don't know, and this is what I want to leave people with here, something that I don't think people understand is, we know with autism now, it's on a spectrum, right? You've got, maybe ADHD, Asperger at one end, all the way up to, severely disabled autism on the other end, and then there's all of that in between. They all kind of fit on that spectrum. Well, a lot of disease exists on a spectrum. There's the dys-ease, the physiology breakdown, all the way through the pathology and things like that. And I always ask this question to people, what's the difference between migraine and a stroke? And the answer is duration. And people don't often get that, is a migraine has that kind of heartbeat like headache or that real like tight squeeze. Well, when that squeeze lasts a little too long, we call it a TIA, or a transient ischemic attack. And if it lasts a little bit longer and actually causes a severe breakdown in function, now it's a full-blown stroke. And so we take migraines really seriously, and we've always classically done really well with them. And that's where I'd like to see, in that hemodynamic flow and how all of that happens, and as we build out the research of the future, is, don't take a migraine lightly. It's not just a headache. And taking an Excedrin for it just takes care of the symptom. It doesn't fix the fact that your blood vessels aren't constricting and relaxing in an appropriate, coordinated way. If you're just taking care of the symptom, you still leave yourself at risk for developing transient ischemic attack, or what they call mini stroke, or developing a full-blown stroke, and the research shows that parallel. And if it doesn't end up being stroke, the decrease in blood flow actually results in what they call small vessel disease later in life, where you decrease the amount of blood flow to the cortical brain regions, and it literally starts to soften them. So kind of as we build into the future and talk about things we need to right the ship on, or rewrite the narrative on, I think that's a big one as well.
I totally agree. And of course, as you know, here at Life, research is one of our main strategic initiatives moving into 2040. And yourselves, in conjunction with Dr. Sullivan and the research department, have created a research agenda moving forward, which is designed to help us identify these types of non-muscular, I don't want to use the word non-musculoskeletal type conditions, because so much of the research in our profession has been based upon low back pain and neck pain, but as we've just been discussing, it has so much more reach than that, and we have to start developing some of the answers to that as it relates to quality of life and longevity and the ability to adapt to have productive quality of life, which is the big issue that functional neurology is about, right? Function.
Yeah.
And being able to live a better, healthier life.
Yeah, functioning at your optimum is how we have a healthier, longer, more fulfilled life. If you go back to the conversation we had with the Marsh, you have to have purpose to kind of drive what we're doing, and I think the purpose is good and kind of where we're headed. So we could nerd out all day, but we like to try to keep these to 30 minutes for everybody, so we'll nerd out more once the camera goes off. And you said you weren't going to get nerdy. You got pretty nerdy with
Was
the
that nerdy? Or I
hemodynamic flow
apologize
and stuff like
if
that.
that was nerdy.
Well, so thank you guys again for tuning in. We look forward to seeing you guys in the future with some more great talks and building those life skills out. Again, the Neuro Life Skill. And you know, the one today is don't sell your headache short. Make sure you're getting that taken care of. Don't just take the medication to cover up that symptom. There's a lot of things that can be done, from movement activities and neuroplastic reeducation to start to work on retraining your brain to better control some of those automatic processes or autonomic processes and improve the health and function of your brain and nervous system to improve your health and longevity. Thank you.